Good morning everyone. I am Mrs. Deepika Sri from the Department of Physician Assistant in Allied Health Sciences. Today I am going to explain the topic about gangrene. Gangrene is the type of dead tissue in our body. It is due to the lack of blood supply or infections in our tissues. The dead tissue often occurs in extremities or skin from loss of blood supply. This condition affects toes, fingers, limb. It can also affect muscles and organs also. Etiology of gangrene: lack of blood supply, infection, traumatic injury. The infection causing organisms are Clostridium myonecrosis, Clostridium perfringens, Clostridium tetani, and Clostridium sordelli. These are the organs induced gangrene. And there are some of the types of gangrene. First one, dry gangrene, wet gangrene, gas gangrene, internal gangrene, foreigners gangrene, Malines gangrene. These are the 6 type of gangrenes. In dry gangrene, it is the type of dry gangrene involves shrinkened skin look like brownish to purple, blue or black in color. Wet gangrene, it is wet, there is the bacterial infection is affected tissue, swelling, blistering and a wet appearance are common features for the wet gangrene. In gas gangrene typically affects deep muscle tissues. If gas gangrene forms, the surgery of the skin may look normal at first. If it is get worsened, the skin may become pale and then turn grey or purple reddish color. The skin may look bubbly and make crackle sound when we pierce on it because of the gas within the tissue. Another one is internal gangrene. Gangrene that affects one or more organs such as intestine, gallbladder or appendix. It is called internal gangrene. This type of gangrene occurs when blood flow to an internal organ is blocked. For example, when the intestine bulge through a weakening area of muscle in a stomach area like hernia and become twisted. If it is untreated, the internal gangrene, it leads to the life-threatening conditions. Foreigners gangrene involves the genital organ. Men are morely affected when compared to the women's. An infection in a genital area or urinary tract causes this type of gangrene. Malines gangrene. It is the rare type of gangrene also called as progressive bacterial synergistic gangrene. It is usually complication of surgery. People when Malines gangrene develop painful skin lesion 1 or 2 weeks after their operation. Now we are moving to pathology. Due to any cause, the normal tissue got infected in the extremities like ear, nose and fingers, which leads to loss of blood supply to the tissues, which leads to it starts necrosing. The color of tissue turns grayish black in color with foul smell is started and then gangrene is formed. The risk factors of the gangrene is diabetes, blood vessel diseases, severe injury or surgery, smoking, obesity, immunosuppressants, and some of the medications and complications of COVID. Symptoms are skin discoloration, swelling, blisters, sudden severe pain followed by the feeling of numbness, foul smelling discharge, thin shiny skin. And we are moving to diagnosis, history collection, physical examination, lab diagnosis. In lab diagnosis, blood test to rule out the infection, blood culture, fluid sample culture, medical imaging, arteriogram to rule out whether if it is related to circulatory problem. CT and MRI, it is used to find out the spreading of the gangrene throughout the body and complications. If we are not treating properly, the patient underwent the amputated, means removal of the affected limb. And then medical management, antibiotics, surgery, debridement surgery, remove the decayed tissue and maggot debridement. It is the non-surgical alternative or traditional debridement. During this procedure, clean fly larvae are placed on the affected area to eat away dead tissues. And then hyperabic oxygen therapy. In hyperabic oxygen therapy, we push out the oxygen into the affected area. And then vascular surgery to restoring the blood flow. There are 2 types, bypass surgery and angioplasty. Bypass surgery, we are grafting, and angioplasty, it is the tiny balloon placed in the narrow or blocked artery in the inflated open vessels. And last one is reconstructive therapy. In reconstructive therapy, skin it's just like grafting. We can replace the normal tissue, and the prevention is cessation of the tobacco and healthy life leading. Thank you.